we reconcile some of the things that we've seen in the news recently about that trial that was recently American Heart, about the risks of cardiovascular poor outcomes and intermittent fasting. I think it's really important to get granular on this. This wasn't actually a trial, it was an abstract, meaning it wasn't published in a medical journal that was peer-reviewed. It wasn't a trial, it was just a retrospective analysis. And what they did is they did food recall for a couple days. It basically said, well, do you remember what you ate yesterday? Do you remember what you had 2 days ago? Okay. And then they said, who's alive at 7 years from today? So they're extrapolating that basically on your recall, that you skipping a few meals for a couple days is going to lead to you not being alive in 7 years. And that doesn't really pass the smell test. We have different levels of evidence, and the strongest evidence is peer-reviewed randomized clinical trials. And studies done by a lot of my colleagues have consistently shown benefits from cardiovascular outcomes in terms of weight loss, blood pressure, cholesterol, etc., from intermittent fasting. People have been doing this again for thousands of years. So it's important to realize that not everything that is presented as an abstract is actually scientifically accurate. There was a great quote that I read recently that really made me chuckle. And it was 100% of people who confuse causation with correlation die. So what does that mean? Well, when you do a retrospective study, you can only say that this may be associated with that, okay? So you can't say that this caused that. And that's really important because there are things that we call confounders, which means that watching TV may be associated with increasing cardiovascular events, okay? But do you think that watching the TV caused the cardiovascular events? Or was it the sedentary lifestyle? Okay. Is it possible that if you watch TV only on a treadmill, that you would be healthy? Or is it the fact that they're sedentary? So you have to be careful not to draw the inappropriate conclusions from the data. And that's what I think people did with this abstract. This wasn't something that had a high, wasn't the highest level of data that we use, and it was not even peer reviewed, meaning that there weren't a bunch of scientists that reviewed the manuscript to basically say, yeah, this is high quality, and this is what you should have changed. So, nor should this be used to change the way anybody does anything. It's a signal that I think has already been refuted. It's not congruous, meaning it doesn't fit with the large body of evidence about the safety of intermittent fasting and time-restricted eating. That doesn't mean that everybody should go out and start fasting. There are certain people that I tell that they really should do so under medical supervision. And these are people who are typically they're on diabetic medicines that help reduce their blood sugar, or they're on insulin. This tends to be a little bit more complicated. Obviously, if you're pregnant, you should discuss that with your obstetrician. If you're undergoing cancer therapy, they might not want you to lose weight. So there's a lot of different caveats to who fasting is appropriate for. But in terms of broad brushes here, time-restricted eating has been shown to be effective in having people lose weight. And we know that losing weight for most people actually is helpful long-term.